versus like the right and the left colic have this very prominent like one. So the sigmoidal, these are going to be the sigmoidal branches. You're going to see multiple. So going to the sigmoid area, and then the last branch, this guy, is going to be your superior rectal. And this one usually goes straight down and it dives down towards the rectum. So overall overview, you've got inferior mesenteric artery, marginal artery, left colic artery, sigmoidal branches of the IMA, and then superior rectal. So also coming off the aorta that you need to know are the left and right renal arteries. So on this side we cut out the kidney, but on this side you can still see you've got renal artery, renal vein, and then the ureter goes downwards. So I think that's all the branches of the aorta. You also need to know the bifurcation. So this is the end of the abdominal aorta, and it splits into your common iliacs. So this would be the left common iliac, the right common iliac, and then as we know, anything that has common is going to split again. So down here, you can see the splitting of common iliac, which runs from here to here, into external here, and internal iliac. Now external iliac is going to eventually turn into femoral, which supplies the lower extremity, and internal is going to be the main blood supply of all the pelvic organs. So common iliac, external iliac, internal iliac. Other structures on the colon that you need to know epiploic fat or epiploic appendages. This is the best way to tell apart the small and large intestines. So these little flaps of fat. You also need to know the tinea coli, which is the nice band of smooth muscle. So this is a nice view of that. This band right here, that's your tinea coli. This body, I don't think we had an appendix. We did this side. Let me go to the other side. Yes, so this is a great view. So here you can see again spleen with the pancreas. So remember, the tail part of the pancreas is nearest the spleen, and the head of the pancreas is going to be right kind of nudged in that little C curve of the duodenum. So on here you can see pancreas, splenic vein, splenic artery. Now here again you can see the splenic vein. You can see IMV dumping into splenic vein. You can see splenic vein joining with superior mesenteric vein to form the HPV, or the hepatic portal vein. Also on here, important, you can see inferior vena cava and abdominal aorta. The left renal vein, I don't think we pointed this out in lecture, the left renal vein comes all the way across the abdominal aorta. The right renal vein is pretty short because the inferior vena cava is more on the right side of the abdomen. The left renal vein, it's long, it comes across here. And importantly, on here, you have the left gonadal vein. In this case, this is a male, so this would be the testicular vein, coming up and dumping into the left renal vein. Whereas on the right side, the renal vein is not as long, and so the right testicular vein would dump directly into the IVC, which I don't think we have dissected out on there. But definitely take a look at that in a book, because that may be tagged just on a different body. Also in this view, you can see, so this would be the renal vein. And on here, this would be one of the adrenal veins. So this is your adrenal gland, sits superior and just medial to the kidney. And you can see the adrenal vein, one of them. This here would be renal artery. So if we followed this, it connects to the abdominal aorta here. This is the renal vein. And then lastly, you have your ureter.